Aaron Rodgers tore his Achilles, and that was a total bummer, but he says he could make a comeback. We're going to fact check that with the greatest injury analyst on the planet. It's time to dig into that, Breece Hall, and so much more. Let's roll, baby. Zoinks! It is unequivocally the Super Bowl for New York Jet fans. Field Yates, baby. Field gosh darn Yates. Let's bring him on the show. Come on, people. Connor Rodgers is joining the show. What's up, Connor? But Trevor gosh darn Sycamore, baby, for me, personally, my favorite New York Jet of all time.
Wow, it's great to be on. What an intro that was right there.
Paul, nobody does an intro like you, man.
Paul, you give the best intro of literally any podcast that I've ever been.
I'm gonna lose my gosh darn bananas. Hey, what's up, everybody? My name is Paul Lesden Jr., a.k.a. Boy Green. I'm the New York Jets digital reporter for Heavy.com. Let's waste no more time. We got to bring this lady in. She's a superstar. She's fantastic, insightful, entertaining, beautiful. She checks off all the boxes you'd be looking for. Stephania Bell, who is ESPN's injury analyst, graces us with her presence. What's up, Stephania?
Boy, they weren't kidding. You do give the best intros on the planet.
That is true. Guilty as charged. Well, Stephania, it's been too long. We did this, it's probably a couple years ago now, but it's always wonderful to connect the dots and chat it up with you.
Well, thank you for inviting me back. I'm going to take that as a badge of honor that I've been invited to return. So,
yeah, I'll be honest, I don't know if you've quite been referenced in this way, but it's almost like a Grim Reaper sense. I want you back like all the time, but also I feel like if I bring you back, it's probably for the wrong reasons. And unfortunately, in very Jets fashion, 4 snaps into the season, we lose Aaron Rodgers, who we hyped up the entire offseason, torn his Achilles, and I've been on this planet enough where back in the day, an Achilles tear used to be like a career ender to us chatting and talking about it. So to hear that now here in 2023 and Aaron Rodgers come out and say, yeah, baby, I could come back this year. I'm like, this season? Whoa, mama. But let's address this in a few layers, Stephania. There's been a much hubbub made about the surgery choice that Aaron Rodgers made. And we had a little Twitter interaction because I said, wow, that it was kind of disgusting, you guys showing the graphic on there, but very insightful at the same time, Stephania, on what was going on here.
Well, thank you. I mean, it was an animation, so let's make sure people haven't seen it. It wasn't like we did actual surgery on the set, but it was a cartoon so that people who might be a little more squeamish about these things, there's no blood involved, but you could actually get a nice visualization of what the procedure that Dr. Elatrosh typically uses on his Achilles repairs is. And I think it's helpful. I mean, this is what I do for a living, right? I talk about injuries and returns. And so I always think it's helpful to illustrate because I can say all these words, but when you see the pictures, I think it makes a lot more sense, don't you?
Oh, absolutely. So it was incredibly insightful, and you're right that I need to get, some steel organs, kind of improve in that department, no question about it. And Stephania, can you even speak to what I just kind of asserted, that, back in the day, and Achilles was like, oh boy, sorry, pal, it's over. And it's still very much on the serious scale, but how has that evolution been since, I don't even know, 20, 25 years ago to what it is now?
Well, there's 2 elements to that. And you're right. It was sort of a death knell for, at least for NFL players. If you had an Achilles injury, kind of that you'll never be the same feeling. And it's because the Achilles is so responsible for power and explosiveness. And after a major, obviously when it's disrupted, you can't walk. I mean, you have basically taken that away. And when you get it back, athletes will tell you, they have to learn how to walk again. And then it's a matter of building back up that power and explosiveness. And even the ones who could get back will often say it would take 1 year to 2 years until they felt like themselves. So the age at which they'd have it, oh, my lights just went out in my room. Let me see.
No, that's okay.
Make them come
whatever
back
lights
on.
you have.
Yeah,
that's
it's
right.
motion sensitive. This is the worldwide leader.
Yeah, the mothership. That's okay.
But anyway, I'll lean in a little bit, so hopefully you can see me.
Yeah,
That,
gather around the campfire. Yeah,
that's I know story. It is like ghost stories, right? You said I was the Grim Reaper, but it's very difficult. It's a long rehab, and so there's the time that it requires, and then what you have to go through to get back to your original self, and then the other aspect is the surgery. Originally these were all done with a large open incision, so big wound, and the surgical repair is pretty substantial. And then in the immediate aftermath, and now the lights are bright. So I have spoken. But then in the immediate aftermath, the foot would be immobilized for a period of time to protect that repair. And just to help people understand, it's so important to protect the repair and not have too much motion early. And they protect it in what we call a plantar flex position. The foot is actually pointing down, like if you were sitting in a chair pointing your toes down. The reason being, you want that repair to heal under tension, because you can't stretch it out too early. If you do, you lose the elastic component of your Achilles, and then you will never get that power and explosiveness back. If you think of a rubber band, like if you were going to slingshot it, if you have a rubber band that's been stretched out, it's no good, right? It's not going to go anywhere. But if you have a really taut rubber band, you stretch it, that's going to fly. So I think that's the element that, in rehab days, we could not push it too early. Now, there's two things that have happened. One is the type of surgery that Dr. Elatrosh uses. I can talk about that in a second. But equally importantly is the rehab. We learned that what we call early mobilization helps. You still have to be very cautious about how much you move the foot early on. Certain range you can only operate within. But that, when we casted people for multiple weeks at a time previously, the ankle would get so stiff it was almost impossible to get the full range of motion back for months and months. But if you start moving the foot and ankle early within a very controlled window, you can then keep that ankle joint with normal fluid going through the joint, normal motion, and that makes it much easier to reestablish normal gait, normal walking patterns, normal push-off. Even though you're doing it under little to no load initially, you're initiating a movement pattern that is proper. And that is what allows you to then move forward pretty quickly. As far as the surgery itself, the procedure is called a minimally invasive mid-substance speed bridge repair. It sounds complicated, but if you break it down, minimally invasive just means smaller incisions. Why is that important? Smaller incision, more rapid wound healing, less chance of infection. It's a very thin area of skin over the Achilles. We know because you can look at it. Your Achilles is right there for you to see. And that makes it a little more susceptible to infection. So anything you can do to mitigate that is good. Mid-substance has to do with the location of the injury. Most injuries are like the middle of the tendon or in that tendon area near the calf. Sometimes it's torn off right at the heel. That's a different type of thing. But if you have a mid-substance, mid-tendon repair, that's what this is. And then the speed bridge technique basically has to do with the actual toolkit that is used to do the repair. And it's a reinforced suture tape, synthetic suture tape that is used to help bridge the tendon. The tendon's kept under tension. And it's a pretty quick procedure. The procedure's been around for about a decade. So it's not like this was just invented. It's not like this is a first time use. Dr. Elatrosh and many others, foot and ankle specialists, if you look at Dr. Bob Anderson, people recognize that name. He has been doing this type of procedure for years with great success. So between that and the more progressive rehab, you're seeing the window of time it takes for a player to get back shrinking.
Wow, we'll see how much that shrinking is here in just a minute. But Stephania, this actually just off the cuff. I don't know if we've been able to determine this, or if we ever could. There was a little bit of hubbub after Aaron Rodgers injured it. There was like the debate, because it's still raging on, between grass and turf, and whether or not that could have contributed, because it wasn't a non-contact Achilles injury. He was being in the middle of being sacked by a Buffalo Bills defender. Is there any way to determine that the turf was part of the reason that it could have given one way or the other? It's kind of crazy on the video that you can see like the calf rupture, like you can kind of see it like bubbles. That's also disgusting, but I'm getting stronger, Stephania. I've been doing my homework there. But like, is there any steps? Yeah, thank you. Is there any way to determine that was a factor, or is that impossible to know?
No, the thing about injuries, and this is what I tend to preach, is that they're multifactorial in nature. You could take all the risk factors. Aaron Rodgers has a profile for risk factors that could have, and I emphasize could have, contributed to this. He's a little bit older as far as athletes go. He is male. They're more common in males. Those things fit. He was doing an activity. When you have an acute rupture, it's often the case that it's happening during a particular type of movement where it's loading. There's an explosive movement about to happen. If you look at his foot, it was planted as he was trying to escape the defender, but he was in that position where his foot was planted and his leg is moving forward. So if you could picture inside at the ankle joint, that Achilles is on massive stretch. So tensile loading as it prepares to push off is basically at maximum capacity there. And then you superimpose the load of a defender falling on you. That alone would be enough to potentially trigger an Achilles rupture. We know he's had calf strains in the past. Could that contribute? Maybe, but you can't say definitively. Could the surface have, the footwear? That there are all kinds of variables that we look at. So it's really tough to say this is what did it and this isn't. And by the way, we're talking on a Friday, and last night, Thursday night, if you were watching the game between the Bears and Commanders, 4 running backs went down. Grass field. So listen, I understand that grass is favorable to most players. And I think just this is a whole topic that warrants a discussion in and of itself. But I think when I hear the conversations, talking to players, what they want the most is consistency of surface. And if there is a turf surface that is deemed comparable to grass, could it at least be uniform? I think that's the place we're trying to get to. What is the best and why is it the best? And can we make that consistent? But yes, the literature has showed, if you look at globally, that more lower extremity injuries occur across the range of turf surfaces. But it's a big conversation that requires really a deep dive into the data. And in that particular case for Aaron Rodgers, it's hard to make the case that alone was a factor with those variables of his position, the guy falling on him. It certainly could have happened on grass as well.
Again, we're speaking with Stephania Gosh darn Bell, baby. One of the best in the friggin' business as far as I'm concerned. And Stephania, let's get into this rehab and recovery. I got a stupid question, so humor me.
No stupid questions. None.
You say that before, Stephania, and then I ask you, like, okay, yeah, forget. Let's cut that out in post. Cut that in post, that middle part where I said there's no stupid questions, because I changed the game there. But positionally, in terms of rehab, like Aaron Rodgers, it was on the Pat McAfee show, said he was working out also with J.K. Dobbins, and he's a running back. And we heard about the Cam Akers story, which a lot of people go, ooh, that was a quicker recovery time. And, everything I'm sure is case by case. But is a quarterback to a running back different because of the explosiveness potentially required to play one position or the other? Does that affect the rehab recovery timeline?
It's certainly the demands of the sport are one of the factors you consider when you're bringing a player back. And what does that player have to do in order to be safe to return to activity? That's what the medical staff is always looking at. So therefore, it is not a stupid question. It really depends on the demands of the player. Now, if you have quarterback who is, I'm trying to, a Jalen Hurts or one of these really mobile quarterback who you expect running to be a big part of their game, that might look a little different than a quarterback who is primarily functioning out of the pocket, But you still need enough to be able to get out of the way, to move quickly, to move up, down, in and around the pocket. So there are some similar demands across quarterbacking, but still a range. And then for a running back, obviously the power and explosiveness becomes a huge factor. And I think that's why people generalize, because they see the running backs who've had these injuries and it's tough to come back from. But I'm happy to say we're seeing more of these running backs who are able to come back and at least prolong their careers of late. And I think it has a lot to do with this early motion and early strengthening and normalizing gait early and all of those factors that we know just help in the healing process.
Okay, a couple more quickies before we get you out of here, Stephania. So Aaron Rodgers, so he goes down at Jet fans. Oh, geez. Oh, good Lord have mercy. He's out for the year. This is terrible. And then Aaron Rodgers drops a couple of notes and quotes like, oh, maybe. And then on Sunday Night Football, which just happened in week 4 for the Jets, he tells Melissa Stark, the wonderful reporter for NBC, sideline reporter, and he tells her, oh, no, my plan is to come back this year. And Jet fans have lost their friggin' minds. Like, yeah, baby, he's coming back. This is great. And I know that's his goal, and the piece of meat hanging in front of him on the proverbial treadmill of life is he should have some level of motivation to push him through this. But is that realistic? Is that possible, Stephania? Huh?
I think this, when we say it's wait and see, it is really wait and see, because you have to look at what has to happen to return. First of all, far be it from me to count Aaron Rodgers out of anything. And we've seen what the great athletes do. The great athletes shatter these myths of barriers and time and what can and can't be done. Look, I did a documentary on Alex Smith, and no one thought he was coming back from that, where he actually had pieces of his lower leg removed and muscle grafting, and people were like, no way is he ever going to play again. And he just came back and took a team to the playoffs. So
that was amazing, by the way. Just quick detour, like, come on, award winning. That was spectacular, Stephania Bell.
Thank you. I did not put it in there for the congratulations, but I appreciate you nonetheless.
Of course.
But my point being that you take exceptional athletes and that mindset, and most of us, we don't do what they do. And I can tell you that my level of motivation is not the same as theirs. But as a physical therapist who rehabbed professional athletes in the past, I know, because I've watched them do these things before. Now, I should also note that you can't rush biology. And there is biological healing that has to happen. And remember, I said earlier, if you overstretch that tendon, you will ruin it for life. So the extreme risk is if you do too much too soon, you disrupt the repair completely, you re-rupture. That's happened to some people. The next phase is, okay, the repair is so strong, but it's still forming, that healing is still happening with those fibers. And if you elongate too much, if you overdo it and you overstretch, then you've disrupted the health of the repair as well. So you want that tendon repair to be solid and comfortable with that before you really push the aggressive, what we call return to sports activity. It typically takes in the 3 to 4 month window for the tendon to heal. Now, some people it takes longer. Some people heal on the early side of that, but that's what they'll be looking at, because the criteria, Aaron Rodgers, he's not sitting around for 3 months, as you can tell because you saw him walking with crutches. He's doing all kinds of treatment and strengthening and so forth within the realm of what he is able to do at this point. But to get that green light to go aggressive into the sports activity requires the biology healing process. So yes, I would say there's a lot of things that are possible that we haven't seen yet, but it's also reasonable to say that this is going to be evaluated on a week-to-week basis for him, and that will ultimately make the determination.
So you're saying there's a chance?
I'm saying there's a chance.
Booyah. Okay, beautiful, Stephania. Jets 49ers Super Bowl. Who says no? Let's roll. Aaron Rodgers, baby. Let's roll. Huh?
Okay, well, let's see. You guys, all of a sudden, playing better, and you guys might have a chance. We'll see. I mean,
all right, beautiful.
I don't want to jinx my 49ers right now.
Of course. They got a big game themselves. Cowboys,
Yes,
49ers, NFC Championship preview, perhaps, for that one. Last one before we get you out of here, Stephania, and shout out to the Jets team. They used some of my voiceovers in it, so pat myself on the back. Thank you very much.
For you.
But they just released this awesome behind-the-scenes documentary. It's almost an hour and a half. It's called Breece: The Road Back, of course, on Breece Hall recovering from his torn ACL and making the comeback, and he provided unparalleled access for the Jets to follow him. So a great trust back and forth. Amazing to see the doctors and the technology. Like, I tore my ACL in February. I have seen none of this kind of equipment as this normal Joe Schmo here, as I've been trying to recover.
I have news for you. Yeah.
Yeah.
They get everything.
Yeah, that's for sure. And just to ask you, I guess, about that, because ACL, and this is probably not the right way to view it, but ACLs to, I think a lot of us just sport fans are like, oh, well, that's okay, Breece. Just come back. Everyone comes back from those really quickly, and it's the same thing. But that also seems like another thing that seems very case by case. But man, that week one, I did not expect 127 yards and the explosiveness, the burst. I think it set a lot of expectations, through some of those out the window for Breece's recovery.
But I think that proves that it's case by case, because how many players come back week one and look like that, and it's tough, because we have become so comfortable with the terminology, right? Everybody throws around ACL. Most people couldn't point to it, I would argue, on a knee diagram, but everybody's familiar that it's this ligament in the knee, and when it's torn, it's bad. But we know athletes can make a full recovery and come back to look like what they did prior to the injury. But it's also important to remember that that's not the case for everyone. There are some people who struggle with their comebacks. There's also many, many forms that the injury can take. If it's in what we call an isolated ACL, where it's pretty clean, just the ligament. Other people have ligament, meniscus, cartilage. It changes the game depending on what the exact nature of the injury is. So when we hear ACL, we're getting usually what's the primary diagnosis, but all the other stuff that's going on, we do not hear publicly. So we can't hold players to the same timelines or expectations. That being said, we got the message early that this was a fairly clean injury. And if you charted Breece's comeback, it was pretty uneventful from the outside. We didn't hear about setbacks.
Correct.
He was making progressions. Robert Saleh talked early about the speed he was hitting, which is great for straight line acceleration, but that's just one element. So until we saw him, we didn't really know. And the other thing that goes with this is the temptation when a player looks good is to put him out there and do too much. And I think in the old days that would have happened because Breece looked so good. And I have to applaud the Jets for actually managing his workload as he got acclimated to football. Remember, he didn't play in the preseason. The NFL has implemented acclimation periods for a reason, because you can come in great physical conditioning, physical shape, but it's not football shape. And there is a period of just getting hit, putting the pads on, doing things with a real defense coming at you that are very different after a major knee injury than your teammates simulating it. So everything has been really impressive about Breece Hall. And by the way, this is another area we have something in common with our teams here. You know what I'm about to say?
No, I don't think so. What is that?
Breece Hall, Brock Purdy, both coming off major injuries.
Yes.
Played together in college. And when I was talking to Brock this summer, when I was out at the 49ers training camp, he talked about how Breece Hall was one of the first to call him and basically be the cheerleader, because he had already had his surgery, and said, it's going to be tough at the beginning, but you're going to get through this. And I think it's really cool that these two guys who are friends, who both kind of lit the world on fire in their shortened seasons that they had, both had major injuries, and both have come back and looked amazing. So I love stories like that. See, I'm not always the Grim Reaper.
Yeah, see, that's great, and that's phenomenal. I'm going to be honest. When Purdy, blew out his arm in the NFC Championship game, and he came back in just to hand off with the other hand, I was like, man, there's no way. Despite all the positivity I was hearing that he'd be ready for week one, I'm like, fat chance. And well, your undefeated 49ers have had other things to say about it. He's been spectacular. So I love those stories, Stephania. That's amazing. And good health to both of our teams the rest of the way. Like I said, to the Super Bowl, wink. And we'll see you there for that. That'd be juicy. Let's will it into existence.
Let's will
Aaron
it. Let's
Rodgers.
manifest it. That's what Aaron Rodgers
That's
talking
right.
about, right? We're going to manifest that into existence. I love it.
Yep. Yeah, that'd be beautiful. Well, Stephania, it's always great talking to you. We'll have to do it the next time, hopefully even sooner. That would be phenomenal because you're fantastic. Thank you so much for taking the time.
You're too kind. Thank you for having me.
Again, Stephania Bell, ESPN's injury analyst. Thanks, everybody, for tuning in, and we'll